to our webinar this evening. This is the University of Queensland Medical School, Ochsner Health. We're going to be doing a quick webinar tonight. So for those that might have missed it and joined a few seconds late, my name's Melanie. I'll be the host this evening for our webinar, Evolution of an Innovative Medical School for the University of Queensland Ochsner Health program. Next slide, please. My wonderful panelists today that have joined us is Dr. Ron Amedee. He's the Dean of our Medical Education. We have Sue Barosse, Director of Enrollment Management. We have Samantha Beland. She's a fourth-year medical student. And we have Josh Savage. He's also a fourth-year medical student joining us. We also have Pete and Kathy that will be manning the chat. So please place all questions into the chat and we'll try and answer them through the webinar. Next slide, please.
Okay, and this is
slide,
where?
Please. Yeah, this is Sue. And off to you, Sue.
All right, thank you, Melanie. So hello, everyone. I'm so happy to get to see you here tonight and be able to have this presentation. I love this slide because it shows where we're located in the world on the east coast of Australia. It's Brisbane in Queensland, and they're here in New Orleans. And we're joining you from New Orleans and from Brisbane tonight. So I really love this title, the Innovative Medical School. And I love hearing Dr. Amedee talk about all of this. So everything I learned, it's from Dr. Amedee and how our school got its start. And I love the alignment and the long history that we have for both entities. So here's the history of Ochsner. It was founded as an academic medical center in 1942. So what? That's 83 years of history here. And these are the 5 gentlemen that founded Ochsner Hospital. And there's their names, Dr. Ochsner, Dr. Burns, Caldwell, Lejeune, and Tyrone. So something that's been standing throughout was the quality of patient care. And they truly have been known for providing a high quality patient care. And that's even today, that was back in the 1940s. And even today, it's our first core value is patients first. And we talk about this all the time in all of our meetings and how we care for our patients, integrity, compassion, inclusivity, excellence, and teamwork. And it's something that everyone embraces that works at Ochsner. So our next slide looks a little bit further into Ochsner. So their first class started in 1944. And then even 4 years later, 2 years later, they increased the number of residents that they were training. So early on, Ochsner became known for their quality of training, and the amount that they do is really recognized. So something also Ochsner's been recognized for is the correlation for smoking and lung cancer. So way back in history, Ochsner has had this standard for research. And it's something that's still embraced today throughout all of Ochsner and the long-running existence we have. And then, again, some of the outstanding qualities are the patient care and the comprehensive training from the medical continuum, meaning from medical students all the way throughout. We even have an education resource center where we teach students throughout all of the local community. So it's truly training throughout, all about medicine and health. Then looking at the University of Queensland and their history, although they were established in 1909 as a state parliament, and they started off with the arts, science, and engineering faculties, which we say colleges today, schools, and within a college, they have faculties within the university. And they did have a small inaugural class with campuses within Brisbane. And today the campuses have expanded, and now they're in St. Lucia, where our med students are, Gatton, Hurston. Our med students are on Hurston as well, and Dutton Park. And I love our old photos that show the long history of the University of Queensland. So they have been around as a public nonprofit organization, and they established their medical school, which was the first one in Queensland, as in 1936. So that predates our hospital by just a few years, right? Just 6 years older. So I love how the evolution of both entities started around the same time. They've both been very involved in research, because as you see here, they're credited with establishing the Gardasil vaccine, and they've kind of been on the same track throughout of history with strong research, study in medicine, and care of patients. Okay, so then we formed our partnership. I love the innovation of thinking of this program to have this partnership in that our student, as you can see the pictures there, that's the New Orleans campus with Ochsner, and then the St. Lucia campus in Brisbane. So the interest for Ochsner was to raise its academic stature. We were training residents, right? But now with a medical school component, we're going to start with out of college or any pre-med student that's interested. They can come here for medical school, and they train with throughout Queensland and then throughout New Orleans and Ochsner Hospital. The rationale or the interest for Queensland to have this partnership was to already strengthen its international multicultural environment. Now they have a whole cohort of US students mixed in with their domestic medical students. So that is very enriching to share cultures and become so closely involved in working with someone from a different continent. So it does enrich their domestic Australian student experience, and then its research enterprise as well. So let's talk about how we apply to our program. That's very innovative as well. As you know, applying to med school is not the easiest thing, and it's costly too. So how can we have an ease of applying? Having an ease of applying really makes us able to find a wider range of those who apply to med school have a lot of roadblocks that prevent them from applying. So having minimal criteria really helps us to be able to find more prospective students that really have a passion for studying medicine. And these are our minimal requirements. So the MCAT, you have to have a 504 or higher to apply. If you have a 503 or less, you're not able to advance your application until you attain that score. So really, a 504 is a good range score. It's above 50% of the grading, and it's an attainable solid score. So I love that if you have that score, that tells us something really important about you as an applicant. It tells us that you're able to take that dense information you're studying for the MCAT and digest that, understand it, and to come out on the back end with a good solid score like a 504 or higher. And if you can do that, then you probably can do med school, right? You're going to be asked to do the same thing. Take this dense information that you're studying, a whole lot of it too, take a test and come out with a good score. So just looking at our class averages last year, the class average MCAT was a 510. And then this year, it was almost that. It was a 509.85. Then looking at our GPA, we're asking for a B average or higher. So that means for us a 3.0 to a 4.0 usually, right? And I have to say B average because the University of Queensland uses a 7.0 scale. So we try to stay away from saying 3.0 to 4.0. But if you're in the US and use the regular 4.0 scale, that's what we're looking for. And that tells us another important thing about you. It tells us that you have at least 4 years of sustained success at that level with an academic program in higher education. And that's something you're going to need for med school as well. You can be able to sustain your 4 years at a grade level like a B or higher. And then subject prerequisites. We ask for physiology and cell bio, but if you don't have that, then we can send you online modules to complete for free. So, I mean, it's very easy, right? Not the same 10 prerequisites, it's 2 prerequisites. So that makes our program available for anyone that has taken these courses, and really opens up the the field to apply to us. After you attain that, you're eligible to be invited for a multiple mini interview. And what I really love about the MMI is that it's the holistic approach. We learn about you from you. We don't know anything. Interviewers know nothing about you when you interview, other than that you've met our criteria and you're eligible to apply for us. So this tests you on personality domains. It's a personality test. They're assessing your personal qualities like kindness and compassion and verbal communication skills. That's just a sample of what we're assessing, but it tells you like what we're looking for, a certain type of person that would be a good, kind person that cares about their patients. And the setup, it's 8 successive 10-minute interviews, all in a row, all on Zoom. Our interviewers just share their screen, and there's different questions that we have for you, 8 different interviews all in a row. So this really does remove roadblocks. So besides the international component for our students, the ease of applying, removing roadblocks and focusing on the individual was really something else that was embraced by the innovation of this program. So it is a very simple, free, online application. So it's just in-house. You go to our website, you can apply directly from there. And that means there's no secondary at all to fill out, and no cost for the first application or a secondary, right? Since there's no secondary. It asks for demographics. You do upload your passport photo page, and you can upload your own official transcript, but you do have all your transcripts sent into the school. So the GPA is based on your key degree, and a key degree is your most recently obtained degree. So it's not a comprehensive GPA that they're looking for, that 3.0 to 4.0. They're looking for your most recently obtained degree, and that composite score is what they're looking to base your GPA on. So what's not required in this application? We do not require letters of recommendation. We do not require that you write a personal statement or an essay. And then there's no resume to submit, which means we're not looking for how much experience you have stacked up. And there's no 10 prerequisites as well. So what's the reasoning for that? Why would we want that? And what's the rationale about that? Well, it reduces the subjectivity of an interview. As you know, an interview could be very subjective. So this is as objective as an interview process can be. It's very holistic, and it does help remove these roadblocks. The multiple mini interview focuses on the application. We learn everything about you from you, the applicant. We're talking just with the applicant. We're not seeing who has more competition stacked, who has more experience stacked up in the competition. We're really just looking at you and learning about you, who you are, and your personality from you. And there's nothing else to bias this interview. So we're not reading letters of recommendation about you or even your own statement. We learn about you from you during the multiple mini interview. So I mentioned research and how it's very important to both of our schools, and clinical school and our medical school. And you can earn a higher degree by research. So that means you're able to add to your MD a Master's of Philosophy. So you could have a MD, MPhil. That takes about a year to add the MPhil. It's intercalated, which means that you will, after your first 2 years of medical school, you stop medical school and you focus just on your Master's of Philosophy. Takes about a year, and then you pick up your 3rd and 4th year by coming to New Orleans. There you also have the opportunity to add a PhD, so an MD, PhD, in which you will stop again, the intercalated stopped where you stop med school after year 2 and start working on your PhD. That could take 3 years or longer. As long as you finish your PhD at the same time as your MD, then that's what's required. What's really great is that these are funded. If you are selected for an MPhil or a PhD, the tuition is fully funded for that, and there's a monthly stipend that you receive as well, as long as you're in the research degree. If you're interested in research but not adding a whole degree, then you can go to the Student Research Hub. This is on our Research tab. Scroll down to the Research Hub, and you can see all of the research that's currently being performed. And if there's anything that interests you, you might want just experience with research or learning how to collect data or analyze data or write the paper. You can get all of that experience that you want by entering the Student Research Hub and jumping onto a program. So I think that that is what I have to talk about, is how this program formed and the innovations that are made to have this amazing medical school. And I'm going to turn it all over to Dr. Amedee, because our next slide, it all works because of how do we match. Dr. Amedee, are you ready?
Ready to go.
Thank you.
Welcome to everyone. Thank you for joining our webinar today. And I'm an otolaryngologist, head and neck surgeon by training. I still practice, but I've been in academic medicine for almost 4 decades now. And I'm fortunate enough in working at Ochsner within the clinical school with a very talented faculty. And to be honest, we're all on the same wavelength, so to speak, that what's important to us and what we get out of it is that we're touching the minds, the hearts, and the hands of the future workforce in this country and to some extent in Australia. And these are the physicians that are going to be caring for us and for our families. We're going to be turning this legacy over to you somewhere in the future once you complete all of your training. And that's a great privilege for each of us to be involved in that time frame with you. I think one of the most important aspects of looking at or choosing a medical school for your future, how well do their students do in the match? So if we can go to the next slide, let's take a look at what we have done for the last 10 years. Busy slide, a lot of numbers, a lot of statistics. Let's just say that if you look at the first 2 columns, first 3 columns, basically, I'm going to take you through the last 10 years, but the number of positions and the total number of applications always exceed the number of positions that exist in the United States through almost any given match year. You can look at that and just see there's always more people that are at the table, but not everybody gets fed in the process. However, when the match is all over with, and you look through the past 10 years, we have quite a match rate, as a matter of fact. And I'm proud to say that we compare ourselves to the MD seniors in the United States. That's our peer group. And as you can see, for the first 4 or 5 years within the match, we were maybe a percentage point behind our peers. But over the past 5 years, we're definitely in the statistically significant better category in terms of overall match for our classes. This past year in May, we had 97%. The MD senior match, who we compare ourselves with, was 93.5. You can see the match rate of students that are in the osteopathic schools. And then that final column, non-US IMGs, which their numbers have been fairly consistent through the past 10 years. And if we can go to the next slide, please. So in this past match in March of this year, our students matched into a number of prestigious residency programs at very prestigious universities and medical centers throughout the United States. This is just a small sampling. We can't list 100 people down here in 100 different facilities. So these were carefully kind of gets chosen. And then you can look on the right-hand side. These were the specialties that our students matched into this past year. And you might look at that and say, well, where's orthopedics? Where's urology? Where's ENT? Where's neurosurgery? We've put students into all of those. They're just not in the match this past year. Next slide. How are our doctors performing once they enter residency? And one of the things that we have been doing since our inception in partnership with the University of Queensland is that we actually sent a questionnaire to program directors in the programs that our senior students have matched into. And we asked them to evaluate our students and give us feedback that we can use in terms of improving everything that we do within the clinical school and within our partnership. And so the next slide will show you what we got from this particular survey. And this is over the past 10 years also. You look at 2012 again. 2012, our school was founded in 2009, but our first graduating class was 2012, and that was the first class to enter the match. So I'm giving you the results of this evaluation of our PGY1 graduates over the past 10 years. I'm very proud of the fact that a lot of the PDs out there, program directors, have participated in submitting these evaluations. I think an overall response rate of 73% when you're sending out almost 500 evaluations is really quite exceptional. As a matter of fact, you can see in the tally over the past decade that 38% of our graduates are deemed by the program directors in their first year internship to be in the first quartile of the intern class that they are training that year. About 50% are in the second quartile, and about 12% are in the bottom half. So if you look at that from another positive way, 88% of our students are somewhere in the top 50%. And you have to realize some of these programs, they're taking in 20 to 30 interns per year into internal medicine, into pediatrics, into other primary specialties. So we're quite pleased with these numbers, as a matter of fact. Next slide. Our outcomes, I think, are extremely important for us to look at. We train our students in different educational, social, cultural, and medical environments on 2 continents. Our graduates have a very broad perspective on global health and healthcare delivery on 2 continents. And one of the things that I think our students, when it comes time to interview for residencies, one of the main advantages that they have a very interesting story to tell, because there's no student in the United States, a senior medical student, that has done what these students have done. And we have fewer and fewer program directors and institutions around the country that we have to teach on what our program is all about. The partnership now is well known throughout the United States. As a matter of fact, we have many residency programs that our graduates have matched into that contact us before the match every year saying, how many more just like the last one you sent us can we have? We'd love to have those students in our residency next year. So actually the match process for us has gotten easier as the years have gone on. And our best salesmen or salespeople in this regard are our graduates themselves and how they perform in the residency setting. Let me call out a couple of other things that I think distinguish them. When you look at research between 2018 and 22, our students, our cohort of students within the UQ-Ochsner Clinical School participated in a substantial number of extracurricular research projects, 247 to be exact. And this represented 40% of the total reported by the entire University of Queensland medical student cohort. Why is that important? Our classes are roughly 90 to 100 students. Back in Brisbane, their domestic class is 400, 425. So when we're producing 40% of all the research entities and processes and projects and papers and presentations and things that have come out of the student body, that's a formidable task, and we've been very successful with that and very proud of that statistic, as a matter of fact. On community service, in the past 8 years, they have logged over 10,000 community service hours, both in Brisbane and in New Orleans, and their activities have included volunteering at outside clinics, public schools to teach elementary and junior high and high school students, to talk with them about a medical career and to talk about their experiences. They participate in numerous community health fairs in 2 continents. They contribute to the Healthy State Initiative here in New Orleans and at Ochsner, which aims to improve community health outcomes for our state. This is important because Louisiana has, as you look at the health rankings on an annual basis, we have been 49th or 50th for probably the last 15 years. And our goal is to have us get to at least 40th in those rankings by 2030. And we're well on our way in that regard. And the students have been a very integral part of that success. We have programs that improve the experience for our students and also offer a lot of support. Our students are involved in initiatives like the Ochsner Medical Societies. Each one of our students is placed into one of the 5 medical societies named after each of the founders of Ochsner that Sue talked about in one of her earlier slides. And these societies provide advising, coaching, and they foster a sense of community within a larger cohort of students, particularly when you're in Brisbane. Patient care, the graduates of our program contribute to filling the need for physicians in the United States. By 2030, we're going to be probably somewhere around 70,000 physicians short. By 2035, it's approaching 90,000 physicians shortage, and we're helping to fill that gap with our graduates. And in particular, I'd like to commend the fact that since we have had students come through our program, go out into their residencies, we have hired back at Ochsner over 40 of them now who are working for the system and are contributing to all the goals that I'm mentioning here and are very integral in terms of mentoring and supervising and counseling our student body. Next slide, please.
That's our last
Contact
slide.
information for you here. If you need further contact information from us on anything we talked about today, you can reach us here. And I'm going to turn the program over now to Melanie, who's going to ask them some questions of our current students. Melanie?
Thank you so much, Dr. Amedee. I really appreciate hearing from you and hearing about the program. All right, I think I'm going to start off with Samantha. What attracted you to the UQ-Ochsner program?
Hello, thanks for having me. It's a pleasure. There were a few different factors. I'd say one of the big ones was just the unique nature of the program. I was fortunate enough to be very well traveled in high school and in my younger 20s, and I had been to Australia and had some ties there. And I just thought it was so cool that there was a program that was relatively straightforward to apply to that also was going to allow me to train on 2 different continents. So I'd say that was probably the biggest factor.
Josh, I'm going to ask you the same question. What attracted you to the UQ-Ochsner program?
Sorry about that. Yeah, I mean, I'll echo a lot of what Sam was saying. Just like a really amazing, unique opportunity to get to not only study medicine outside of the country while also getting your clinical experience in the States and being competitive for US residencies. But yeah, it was a really unique opportunity for me personally. Finishing undergrad, I wasn't sure if I was ready to go right into medical school. I wanted to travel around. I wasn't sure if I wanted to stay in the South, leave the South. And then I stumbled onto this and I was like, is this even a real program? This is absolutely perfect and everything I was looking for.
That's awesome to hear. Yes, Dr. Amedee, you have your hand up?
I just want to add one thing for our listeners. Our student graduates have the possibility of practicing in 2 continents. Their degree allows them to practice in Australia and in the United States. And about 8 to 10% of every graduating class goes back to Australia for love of country or love of somebody else. So that's what I wanted to add. Thank you.
Thank you so much, Dr. Amedee. That's a very important point. So Samantha and Josh, did the ease of applying impact you or your decision to choose the UQ-Ochsner program?
Yeah, absolutely. So like Josh had kind of shared as part of his story as well, I also started working out of undergrad because I always wanted to go to medical school, but I was a little bit unsure about what that would look like at that time in my life. And so I had a lot of work experience, most of it in the medical field, but I felt very unsure about that process being removed from the thick of it in university and having people to talk to. And so it was definitely a very nice factor to be able to just have a relatively easy application. You just did the basic things that we needed to do, and then they got to see who you were as a person from there. So yeah, definitely made it a little bit easier.
Yeah, absolutely.
Awesome.
I mean, I think the process of medical education definitely favors people who have the resources, whether financial or, family connections to kind of help them be in the best position to apply to med school. And I think that this program kind of, like Sue was saying, kind of removes those roadblocks and makes it easier for everyone to apply, kind of puts people on a more level playing field. And I think that made me feel a lot more confident applying, that, I was looked at as just based on my own merits in the interview and not necessarily what I what I was bringing to the table as far as, my grades or my extracurricular activities.
Awesome. Thank you so much for sharing. What are your guys' thoughts on the holistic approach to the MMI? It sounds like you really enjoyed that.
Yeah, definitely. I think Sam and I both actually help out in the MMIs. Sometimes we run a station. It's a lot of fun to just get to, hear somebody kind of be thrown into a situation and get to, kind of talk their way through that. And it's also just a really cool, chance to present yourself, and then maybe if it doesn't go as well, move on to the next station, kind of a wash. You have a new person that you're interviewing and you kind of start over fresh, which I think can be helpful, especially it's a really nervous time, and, just kind of that ease of getting a fresh start at every station.
Yeah, I think one thing that I like about the format is that you need to prepare, and that's very important, but you can only do that to a certain extent when you have those time constraints and you don't know necessarily what the questions are going to be. And so it's sort of comforting that at that point, your personality and just who you are as a person is going to have to shine through. And so there's a comfort in knowing that your colleagues are also chosen in a similar manner. And so it's not just all rote memorization and the facts and things like that, but people who actually have compassion and the values that we've talked about are those that are going to be selected for the program.
Thank you guys so much for sharing that. So Sue talked earlier about research and how important it is to both the University of Queensland Medical School as well as to Ochsner Health. Have either one of you participated in research? And if so, can you share your experience? Either one.
Yeah, so I chose not to focus on research to a significant extent during my first 2 years, just because I wanted to focus on the copious amounts of medical knowledge that there are to work through during that phase. But I was a little bit worried that I wasn't involved enough at that stage. But as soon as we got to Ochsner, there are so many different ways to get connected. The faculty here, almost everyone has some type of project going in every field. I even found some that sort of aligned with my particular interest in health equity and surgery, which is relatively unique. And so absolutely, there's been multiple opportunities here, and everyone's just been great at facilitating, and it was relatively easy to get started with as well.
Yeah, 100%. Both UQ and Ochsner are really great about providing opportunities to get involved with research. We get, emails all the time about research opportunities and different projects, and, contact this person if you want to get involved. So it's all 100% out there for anybody interested.
Awesome. That's so good to hear, since it's such an important part of our program on both sides. Do you guys have any comments about your time in Australia and the US regarding broadening your perspective on global health or the impact that studying medicine on 2 continents has had?
Oh, wow. There's definitely a lot
that's a
to
lot.
do at that point. I would just say that it's an immense privilege to witness how 2 different countries work. I was fortunate enough to see it in Australia, both as a provider and as a patient. And comparing and contrasting the 2 is just such a unique opportunity, but you can also take what you've learned and apply it to try to help people in the different settings and vice versa as well. So, yeah, there's so much that you could say about that, but as a very straightforward answer, yes, absolutely. There's no way that you could walk away from this experience and not have just an understanding of how different parts of the world work and the privilege that we have, the privileges that they may have, and how everything works together.
Yeah, definitely. There's a lot of kind of unique differences between the Australian health system and the US health system. So it's really cool to kind of get to be a part of both of those and see what that looks like in the healthcare field. It's really cool.
Awesome. Do you guys think that sets you up to be a global leader in healthcare in the future? Having that experience?
Absolutely. I think it's, like Dr. Amedee was saying, it's an experience that not a lot of US medical students get to have. So we're kind of in a unique group of people who have gotten to have that experience early on in our medical career, and we get to take that into residency and as attendings moving forward.
Yeah, absolutely. I have a particular interest in and passion for global health and health equity. And I had many opportunities at UQ, University of Queensland, as well as back here at Ochsner New Orleans to act on that. I was able to do an immersive experience abroad for a medical aid trip that was assisted by Ochsner. And then within Brisbane as well and Queensland at large, there were many opportunities that I had. And so all of those experiences have shaped who I am, and just add to the picture and the story of the unique education that we've had too.
Awesome. Thank you guys so much for sharing. If you can share a little bit more about your experiences treating diverse populations and how you've been exposed to those diverse populations during your medical education, that'd be great.
Yeah, I guess I can just expand on my previous point because I suppose they're tied together a little bit. So for me in particular, that's something that I seek out, but it was also something that was very easy to find. So let's see, in Brisbane, I worked with a certain project that was assisting the unhoused population in Brisbane with receiving vaccinations, as well as just general health care. And so that was a unique opportunity. I was also very involved with student organizations that allowed us to go and work within some of the Aboriginal and other Indigenous communities in Queensland. And that was, I would just say, life-changing to be able to have that experience, and how glad everyone is for you to be interested and to try to help and kind of have those grassroots impacts. And then that's translated over to, like I mentioned, that other global health opportunity here. So yeah, definitely there's a huge focus at the University of Queensland at large on those kinds of things. And that was great.
So we do have a question in the chat. And Sarah is asking if you can speak more about the medical trips you mentioned, and are they part of the program or through the school?
Absolutely. So the nuance of that is probably going to change from year to year. The particular program that I did was in Panama with an organization that has a presence that's based there, that isn't directly affiliated with Ochsner, but that one of the clinicians sort of had connections with. And so I wouldn't say that it was something specific to do with Ochsner or the program, but it was facilitated in that the faculty had connections and helped us put that trip together. So I spent 2 weeks in November to December of last year in Panama on that medical aid trip. And then there's often other trips. Like I said, it can change from year to year, but the faculty have connections with other countries like Haiti, Colombia, et cetera. So there's ample opportunity, but it might not always be the same. And it's not necessarily part of the curriculum, but it is assisted by Ochsner. I hope that helps.
And the next,
Awesome. Thank you so
the next
much.
rotation, the next elective that will be added in 2026 will be Bolivia.
Awesome. It seems like we lost Josh. I hope he's okay. So I'm just gonna keep going on. Samantha, what are you most proud of as a UQ-Ochsner student?
Oh, wow. I think I would just say I'm proud to be able to sort of bear both of the organizations' names, that's for sure. It's definitely a privilege to have been able to train at a university in Australia that is so highly regarded and is one of the top 50 in the world as well. And Ochsner too is particularly in the Southeast, but in the US, as Dr. Amedee mentioned, it's becoming more and more well known as we spread ourselves far and wide across the country. Just having those two names and the positive associations with them is something to be very proud of, as well as the clinician that I feel I'm going to be able to be just by being a part of this whole experience.
Thank you so much, Samantha. So I'm going to open the floor now to our questions from chat and see if we can get some questions answered. So guys, pop your questions into the chat. This one's for Dr. Amedee. I think you'll be the best one to handle this. Kalisha says, thank you so much. Can you talk more about the mentorship and support you received in moving to Australia, as well as navigating the medical school as an M1, learning about research, career guidance, and step preparation? Samantha might want to jump in to help with that.
I think, Samantha, I'll let you go because
Okay.
the only role I have in that is that I am in Australia when you arrive to start your medical career in Brisbane. But the intricacies of the questions you have asked will be better answered by somebody that's actually got experiential knowledge in that particular area. So, Samantha.
Yeah, absolutely. I would say that that's probably one of the strengths of the program, is just how supported we are, because they understand that this is it can be very intimidating if you've never, if you're not as well traveled as some of us, or if you haven't traveled abroad particularly. And even if you have, it's living somewhere else and moving to another country, especially with all the stress of medical school, is a big deal. But I think that they've been doing this for long enough that there are tons of processes in place to help, as well as a very collaborative student environment. So I'd say that's one of my other favorite things about the program has been the collaboration between students and between year levels. It never feels like competition with your peers. Me and my friends talk openly about our scores, something that tends to be very taboo in a lot of other programs. And so that openness helps. And then there's mentorship and support from the faculty side, but also among your peers. So there are countless Facebook groups, spreadsheets, peer mentors that you're assigned, guides that are many, many pages long about different neighborhoods and things to live in. We also started this journey while COVID was still was a larger reality, particularly in Australia at that time. And navigating that was obviously also very scary, but we were supported just throughout the process. So I'd say there's lots of different levels that help with that. So it was never a concern. I never felt unsure. And if I did, you can reach out. All of the faculty and the administrative staff are just great.
Awesome. Thank you. Josh is back. Hey,
Hey,
Josh.
sorry about that. Hey.
So we're just going to do some question and answer through the chat right now. And so this might be a good one for you to take. Can you expand on how the university helps prepare students for the U.S. board exams?
Yeah, absolutely. So as part of our curriculum while we're in Australia, in your second semester of your first year, you take a class that's specifically geared towards helping you get ready for the Step 1 exam. So throughout that class, you're taking tests. I think you do like 4 within a semester, kind of making sure that you're progressing on that track to be ready to take the test when you get back to the States. You also have tutoring sessions with usually like a 4th year or 3rd year student who's already passed the class, who kind of takes a group of maybe 10 to 15 people, goes through practice questions, helps like work through complicated topics. But as well as that, you also have, provided by the school, access to UWorld, which is a question bank that has thousands and thousands of practice questions that you can get started on really early, kind of just helping you get mentally prepared, because it does differ a little bit from the curriculum that you're studying while you're in Australia, but through Ochsner, you're provided with all the resources that you need to succeed.
That's so awesome to hear that you guys are supported like that as you prepare for, you know, your exams. So here's another question from the chat. Aaron asks, what are the most common extracurricular or leadership opportunities available in either Australia or the US for students to participate in? So I think that would be either Samantha or Josh.
I would say it is a very robust set of opportunities. particularly in Australia, actually, there is a University of Queensland Medical Society, and it has so many different arms and branches that encompass anything you could want to do, whether that's performing arts, whether that is advocacy, or working with policy and things like that, all the way to volunteering. And then whether there's a specific interest that you have within the medical field, there is an organization for pretty much anything and everything. And if not, you can create one of your own. And then that translates back to us here at Ochsner as well. There's, if I was just guessing a number, 20 to 30 different student interest groups. Again, that align with pretty much anything you could be interested in. So there is no shortage of extracurricular experience to be had that's directly through either University of Queensland or Ochsner.
Yeah, definitely. Any specialty that you're interested in, that you think you might be interested in, there's an interest group for that. You get connected with students and faculty who are also interested in that. That just opens up, gateways for mentorship and connections. There's also a ton of like intramural sports. It's like a tennis club. Some of my friends back in Australia started a UQ Med bowling team. There's all kinds of different stuff.
That's awesome to hear. So Josh, you did miss a question that I was really interested to hear the answer from you. So I'm going to ask it now, if you don't mind. What are you most proud of as a UQ-Ochsner student?
I think that what I'm most proud of is just being a part of a program that really tries to provide opportunities to students who might not necessarily get the same chance to enter medical school and get to become a doctor. I just think it's really awesome. The whole admissions process and the types of students that we're able to let in based on the differences in how some of the other schools do it. I think it's just really great.
That's awesome. Thank you. So we do have a question from Melissa in the chat. She would like to know more about the grading system within the program.
Yeah, so it used to be a lot more complicated because it was on a pass or on a 7-point scale, but now I believe all of our classes are pass-fail now. So you just get a P. That's what goes onto your dean's letter on your transcript. And UQ does keep track of your grades in the background to be able to rank you at the end and separate you into quartiles. But as far as your transcript goes, it'll just be pass.
Thank you so much. Khalees asked a question about how the curriculum is structured. Is it more lecture-based or problem-based learning?
I'd say it's a very diverse mix of both. So there is tons of lecture content to keep things structured and uniform, but then there's also tons of ways that you experience problem-based learning, whether that's getting involved in clinical teaching early on or working with a small or medium-sized group to focus on cases. It's really got all of it. And then the testing frequency and the structure, that's a little bit more intricate, I feel like, to answer in this format, but I feel like there was nothing that was lacking. It was very robust at a minimum end of semester exams. And yeah, probably a better question for Dr. Amedee to answer.
Well, I'll answer it this way. As a matter of fact, it's not uncommon for me to have one of our own students with visiting students that are coming to do rotations at Ochsner from other schools in Louisiana, other schools around the United States that are doing audition rotations, for example. And one of the things that is very clear to me and has been demonstrated countless times is that when there's a UQ student in the midst of all these visiting students, the one student that's the most comfortable interacting with the patient and their family and asking the right questions so that we can develop a thorough differential diagnosis, start developing a treatment plan. It's our students that they have been talking to and working with professors in Brisbane all the way through New Orleans in terms of how to interact with people. And I think their experience abroad, bringing that back to the States, brings another level of sophistication and maturation in their case that just makes interactions with patients so much easier for them. And it really shows. It's almost like it's a halo over them compared to anybody else that's on the rotation. It is a distinguishing characteristic, and that just doesn't happen. It's some of that is their good upbringing, hopefully, but a lot of that is what Samantha just talked about. The balance between didactics and the balance between clinical settings and the amount of time that you have working and being mentored by outstanding clinicians, both in Brisbane and in New Orleans, to become the best physician you can become. Thank you.
Thank you, Dr. Amedee. So this is to all the panelists. Is there anything you'd like to add that you think is important for our webinar participants to know, or you'd like to share with them about, you know, the program, your experiences, anything like that?
I wish this program was around when I was a medical student, because I'd have jumped at it immediately. Knowing what I know now, Brisbane is an incredible place to live and to train and to learn. It's a very youthful city. It's a very vertical city. Incredible people, very friendly. It's a river city, just like New Orleans. And New Orleans has the tradition of being a big party capital in the United States, but it's a wonderful place for people that live and work here, that instead of having to hop on a train or a plane to go take a vacation someplace, they can step off the merry-go-round in New Orleans and have an incredible time in their own city as a tourist. It's a wonderful place to be. It's great food again, wonderful people. And I think the partnership really draws those features out without a doubt between the two locations.
I will add that I love how this program identifies those that have a passion for studying medicine. I love being on the front end and meeting with prospective students and talking to you guys. I know some of these names in our chat room right now, and I've met some of you, and I love hearing your story and being able to go through this admissions process and the application process really does let your passion for studying medicine shine. So I get excited about my job because I'm so excited seeing your passion living in you.
And last year, Sue and I traveled to welcome the students in Brisbane. And I'm there as head of the clinical school, you know, I've got my piece that I have to say. But Sue just walks in the room and it's like a rock star arrived. I mean, every one of the students immediately knew who she was and that she had been very instrumental in getting them to where they were at that particular moment. So it was fabulous to see that. I mean, it is your passion, without a doubt, to see these people succeed. Thank you.
Thank you.
Yeah,
Samantha or Josh?
I would just encourage anyone who is interested to apply. It's a fantastic program. Best decision I ever made. Meet incredible people, get to have the opportunity of a lifetime. Just go for it.
Yeah, absolutely. As a summary to what they've all shared, I feel like this program found me. I don't know if I found this program. I mean, I guess I did technically. And I think that it is something that brings the students within the Ochsner cohort together, is that many of us have had some type of unique background that might have led us to this program, whether that's that you took a few years off before you decided to go back to school, or that you have an interest in travel or different things like that. And so like the camaraderie, the friendship, the collaboration, all of that is something that I really don't think you could find in any program based in the US. And that's, you know, just from speaking to other friends that I have that have gone through medical school in an entirely US based program. So it's definitely a privilege to feel so comfortable and confident with everyone from your colleagues to the faculty and feel well supported.
Awesome. Thank you, guys. I think we do have one last final question in the chat. I was going to wrap it up, but let's just get to this question. What are some common things UQ students like to do to take a break from studies?
Anything that normal people like to do, whether that's travel or sports or a night out on the town, and whether that's in Brisbane or in New Orleans, I'd say anything that you can think of, there's somebody here that would probably enjoy doing it with you. New Orleans is a great place, as everyone else has said as well, to to visit and to live. In fact, it was something I was a little bit interested in because I had never been to New Orleans. And then getting here, I've absolutely fallen in love with it. If they're lucky, I'll stay here.
Yeah, literally anything. Go to a concert, go to the beach, go eat some great food. Yeah, there's so many things to do, both in Brisbane and in New Orleans. You won't have any problems finding anything to do with your off time.
Awesome. Thank you guys so much, panelists. I really appreciated your time and you coming to this webinar and sharing with our prospective students. Thank you, everyone that logged in and signed up for it. Our next webinar is August 14th. You can register right on the website, and then we will see everybody then. Thank you guys and have a great evening.